This week on Heal Yourself Radio, we're talking to Dr. Michael Arata. Dr. Arata is a specialist in interventional radiology and he practices functional medicine. He's no stranger to scrutiny from his peers and is considered by some to be a black sheep in medicine for his non-conventional views on disease treatment and because of an innovative treatment that he developed and published research on its efficacy. On this episode, we'll talk about difficult to treat disease like multiple sclerosis, fibromyalgia, and a condition called dysautonomia, which may affect a lot more people than you think. He'll give his tips from a functional medicine perspective on being able to live with chronic illness. Remember, don't rely on this show for medical care. Before pursuing any treatment, talk to your doctor and see if it's right for you. And before we go forward, we're going to ask you to go over to healyourselfradio.com and subscribe to our newsletter. And if you like what you're hearing, then please give us a review on iTunes, preferably a 5-star review. I hope you enjoy this interview with Dr. Arata, and I think you'll learn a lot because I sure did.
You're listening to the Heal Yourself Radio Podcast. Unleash the Doctor Within with your hosts, Dr. Jonathan Chung and Dr. Gregory Jean-Pierre.
Welcome to another episode of Heal Yourself Radio. I'm Dr. Jonathan Chung, and we're talking about ways to unleash the doctor within. Today I have a special guest. I have Dr. Michael Arata. Dr. Arata is practicing in Newport Beach. He's trained in functional medicine, but he's also board certified in interventional radiology. He is a graduate of the University of California, San Francisco School of Medicine, trained in his residency at Duke University, and you could say he's a bit of a pioneer in some of the treatments that he has for people with rare diseases. Welcome to the show, Michael.
Thank you. It's great to be here.
So, Michael, why don't you give us a little bit of background about yourself and how you came on to the work that you're doing now?
Sure. Well, as you mentioned, I'm an interventional radiologist, and when I first came out to Orange County after completing my training at Penn, I was practicing, you would say, pretty traditional interventional radiology. And I had an interest in two things. One was venous disease, and the other was limb salvage. In particular, that was with patients with primarily diabetic ulcers and gangrene, things like that. So I dealt with patients that had a lot of chronic illness. And while I certainly enjoyed trying to save a limb, while I was doing it, I was thinking, it's a shame that we couldn't catch this earlier because, you go through a lot of effort and you certainly spend a lot of money trying to save limbs nowadays with the technology. So it sort of struck my interest in more of a preventative approach. And then about 5 years ago, when I was sort of dealing more with venous health, I was introduced to a new treatment that was developed actually in Italy for patients with multiple sclerosis. And with that, it was a venous procedure. And I started doing a lot more of those treatments and seeing a lot more patients with more neurodegenerative diseases. And that's when I really started scratching my head saying, gosh, there's got to be something you can do earlier on in the course of the disease or to prevent it, entirely. And I came across functional medicine, and it was just an amazing sort of serendipity because I just absolutely fell in love with the whole concept of functional medicine and jumped right in and got trained in it, and been practicing for a couple of years now with it. And while I still do some procedures, I really focus on the functional medicine aspect. It's the bulk of my practice is actually the functional side of it, and the procedural aspect is now actually a minority, maybe one day a week. So the goal for me is to incorporate technology along with functional techniques to really try and bring healthcare to a whole nother level. And that's sort of my story.
Excellent. So just for people that don't really have a strong grasp of the difference between traditional medicine and functional medicine, can you give us a layperson's explanation of what functional medicine means?
Sure. Well, I think first of all, functional medicine is personalized medicine. So I think that's probably one of the primary points to make. And then the other thing which I like to use to explain it to people is that with a traditional approach, you're really trying to narrow everything down to one thing. You know, the differential diagnosis is sort of the process that you learn in med school, where after gathering some information from the patient, whether it's a physical exam or history or whatnot, or tests, you create a list of things that could explain what the patient's going through, and then you try and further, you know, weed through that to come up with one thing. And that process is one where you're eliminating variables. You know, you're just basically trying to narrow down to one particular thing. Well, that, in my experience, just doesn't happen with human beings, because we are a huge bag of variables, and you cannot isolate one system from the next. If you deal with let's say, you know, anyone over 65, the chance that someone's on you know, several medicines is quite high. So you have the potential for interactions not only with your own physiology, but the things you put inside your body from a medical perspective. And then on top of that, your food choices, whether you're active with exercise, whether you sleep, there's so many variables that come into play that affect your overall well-being. To, you know, to basically make healthcare decisions on a reductionist approach just doesn't make sense to me. And functional medicine is basically saying, you know what, you have all these variables, and we actually want to consider them all. So it's a more realistic look and natural look at the body, where you're going to consider the variables and you're not going to try and exclude things. So I think those are the two main differences.
Yeah, and I think that's something that, as I've started to accumulate some more years in practice, that, you know, in school we're always taught to follow a certain algorithm, and people will fall into this algorithm, but the more that you see patients, the more exceptions to the algorithm there are than people that fall into the rule. Has that been your experience as well?
Yeah, absolutely. And so I guess, you know, as far as medical education goes, maybe it should be more focusing on, you know, pattern recognition. You know, it's just trying to see all these different components and coming up with ways to understand them as they interact with each other.
Definitely. So is that something, I know that when we met last weekend, we talked about how you're kind of considered like a black sheep in medicine. Is that just one component, or is there anything else that makes you a little bit of the black sheep in medicine?
Well, I suppose to a certain degree, you know, functional medicine would fit that. Although I think it's moving more mainstream. For example, there's a program now at Cleveland Clinic. So I think, yeah, that's in general, functional medicine would be sort of considered a black sheep type of area, but I think it's less so. For myself, my own practice, I think the other aspect that would make it that way is that I've developed a treatment, a procedure. And so anytime you have something that's new, whether it's a procedure or any kind of treatment algorithm, you know, it's not accepted necessarily by mainstream medicine. That's going to be looked at a little bit differently. So I think that the fact that I do have that treatment that I developed, that certainly would put me in that category.
Okay. Can you talk about this treatment?
Sure. So the treatment is a procedure for a condition known as autonomic dysfunction. And autonomic dysfunction, actually, as it turns out, is actually pretty common. And it's just not one that's really recognized as part of different diseases or in isolation. So, for example, if you look at many chronic illnesses such as fibromyalgia, for example, or Crohn's disease, rheumatoid arthritis, multiple sclerosis, you know, things that most people actually either know someone with that condition or may actually have themselves, they will often have autonomic dysfunction as a component of their illness. You can have isolated autonomic dysfunction. It can be something that is genetic and you're born with it. It can be acquired. So, for example, if you have a spinal cord injury or a traumatic brain injury, you can develop autonomic dysfunction. So a very diverse population of patients can have this, and there's not really a treatment per se. There are some medications and other therapies that may ameliorate some of the symptoms, but you can't go and just get a treatment to take care of it. So I've developed a procedure based on a reflex in the body called the venous distension reflex. And the procedure involves inflating a balloon in the vein to stimulate this reflex. So it's a endovascular procedure. But as far as a invasive procedure goes, it's pretty minimally invasive. I actually do it in the office setting. So it's much more patient friendly, for example, than going to the hospital for treatment. But it is an invasive procedure, so there are risks obviously with any invasive procedure. But this procedure is a hopeful option for patients with autonomic dysfunction, and we've been having some interesting publications come from our study of this procedure, and had one actually a couple weeks ago. So we're pretty excited about the progress we're making in the research side of things. And it's one where I hope to see other physicians actually start to do it. So I'm always looking for physicians interested in learning the technique.
Has there been a demand for other physicians to learn the technique?
There actually has been some interest all across, actually I should say internationally, because I've actually been abroad and lectured about it. And so there's a group of physicians in Sicily where I visited last year that actually have developed a similar procedure. It's different in that it's a surgical procedure, but it addresses the same population of patients and works on basically the same principles. So that's the closest I've encountered to someone doing the same type of work. And then there have been a couple of physicians in the United States that I've been in discussions with about getting a program started for them.
Awesome. And for our listeners, I'll actually post links to some of the abstracts that Dr. Arata is talking about, some of the publications about this procedure, so you can have access if you're interested in it. As far as patient populations go, what are some characteristics about a patient that would respond well to this type of treatment?
Well, the types of symptoms we see responding very well are things like thermal dysregulation. So one of the characteristics of the autonomic nervous system is that it controls temperature regulation, and patients with autonomic dysfunction will have difficulty in environments that aren't tightly regulated. So, for example, if you go outside in the hot sun and you have this condition, you will not do well. And if you have other symptoms, for example, if you have fatigue and you go out in the hot sun, your fatigue gets worse. If you have difficulties with thinking, your cognition is impaired, and you get into a hot environment, that gets worse. So that is a symptom that tends to respond very well to treatment. And in fact, an example of your thermal regulatory abilities, which can be improved, is the ability to perspire. So one of the features of patients with autonomic dysfunction is they don't sweat, or they have impaired sweating capabilities. And so we have patients literally in the recovery room right after the procedure start sweating, and sometimes it's the first time they sweat in decades. So it's it's pretty interesting to see that actually physically take place within a few minutes of the treatment. But that's just one of the things. The other aspects that tend to be good for patients is they deal with fatigue itself. So fatigue certainly is multifactorial. You can have any number of things can lead to fatigue. But if your fatigue is in the setting of autonomic dysfunction, it tends to respond very well to treatment. So those are two things that I think help me trying to identify patients is, do they have fatigue as a major symptom set, and do they have thermal dysregulation issues?
So we're talking really about a spectrum of diseases that could probably include, MS, Lyme's disease, chronic fatigue, and those types of things as well, correct?
Absolutely, yeah. So those are certainly very common diseases that I see in my clinic. That and fibromyalgia will be another one.
Okay. You also seem to have a knack for, I guess, rare diseases. Like one thing that caught my eye, and I'm working on a paper about it myself, is POTS disease. Did something attract you to some of these really difficult, challenging cases?
Well, it's sort of I guess for POTS, that's a type of autonomic dysfunction, and the symptom set or the patients that I saw, for example, with multiple sclerosis or Lyme disease, they are very similar to the symptoms that a POTS patient would experience. And in fact, if you have multiple sclerosis, there's a reasonably good chance you actually suffer from POTS. There's been a couple papers on that actually. So there's a bit of overlap, you could say, between the conditions. POTS, in the classic sense, is a condition of young people. They tend to be teenagers or early 20-year-old people, and it hits them really in the prime of their life. And so for that population, not really having a lot of good options for treatment, it really meant a lot to me to be able to help that group. I look back on my 20s and, the idea that I would have a condition that would really, keep me homebound and not allow me to go to school or to participate in sports. And that would just be devastating for me. So I guess at a personal level, I really kind of wanted to make a difference for that group of people. And so it is something that I have an interest in focusing on my practice to try and offer something for a condition that doesn't have a lot of options right now.
Sure. And, just on a personal level, I know that you work with doctors like myself who really focus on correcting the upper cervical spine. What's your experience been with upper cervical chiropractors?
It's been great, and I really rely on my colleagues in the NUCCA world, and it's been something that I think it's been over 3 years now that I've been really relying on them for my patients, and I would say almost half my patients I end up referring to a NUCCA specialist. The interesting aspect of what I'm doing from a procedural point of view is that the area where I'm working is primarily in the neck, and we see that at the craniocervical junction that there is pathology that's evident in the vein. So the procedure I do is vein-based, and I can identify abnormalities from the procedure, the venogram procedure, that are related to posture and alignment. And I don't know necessarily that the obstruction in the venous flow has anything to do with it or not, but it does reflect this problem that guys like yourself are really the only people I know of that can actually address that. It's not something I can fix. There's no technique I have to address it. So I think there's a really good partnership for at least the patients I see between what I do and what upper cervical practitioners do. So it's a real intersection, if you will.
Yeah, I think a lot of the images that you were showing at a conference when you were there and speaking were pretty compelling, and it's talking about a lot of the things that we've been talking about in the upper cervical chiropractic world for a long time, but we just never had the imaging capabilities or the right people to look at it to confirm a lot of the theories that we put out there. So it's been pretty cool to see that someone as yourself brings some of these things to light. So we appreciate that.
Yeah, it's great, and I think that the more that we collaborate and work together, the more we'll learn about this and hopefully have better solutions.
Definitely. So let's get a little bit into more of your functional medicine background now. What things do you focus on in your functional medicine practice that you think can really help the average person live a better, healthier life?
Well, I think the biggest thing for me is the value of two things: one, sleep, and two, other human beings. I think that everything you do for a patient really kind of hinges upon their sleep quality. If you have diabetes, or if you have problems with any other hormone, if you have problems with a neurodegenerative disease, I mean, the list can go on and on. If you're not getting good sleep, it's going to be difficult to get that patient to where they want to be in their wellness. So I really focus on sleep with my patients. And the other thing which I think is really important is the social interactions of the individual. And perhaps I focus on that more because it doesn't seem to be something that other practitioners focus on. So I kind of feel like I want to pick up the slack, so to speak.
Sure.
But if you think about it, Our physiology really has developed in a social environment. We're social animals, and the functions of our body, and in particular the circadian functions, really kind of fit with how we interact with other human beings. But unfortunately, we've seen a significant change, particularly in the last decade or two, in our behaviors. So our social interactions, used to be more tribal, and we actually took more time where we were more parasympathetic in nature, and now we're rush, 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 sympathetic overdrive, and we tend to not take the time to be with other human beings. And I don't think our physiology has evolved to match that. And I think that some of the issues with the autonomic nervous system and dysautonomia perhaps are a result of that. Is that the body just simply can't get into optimal balance between parasympathetic and sympathetic function because of the changes in our social dynamics. So I really work with patients to, actually take time to slow down, to interact with other human beings, and certainly a focus of that is mealtime. So I really stress having meals with, the family or friends if there's no family, to optimizing the parasympathetic aspect of eating, and the benefits of oxytocin, which come from our interactions with other human beings and in touch. So those are the two things that are really, I would say, the key things I focus on.
That's awesome. It actually just reminded me of this book that I've been reading. It's called The Story of the Human Body, Evolution, Health, and Disease by Daniel Lieberman. And he actually, excuse me?
I was say that sounds great.
It's been a really cool read for me because he talks about mismatched diseases, about how we evolved and how the current lifestyle that we're living in doesn't match what we were evolved to do. And he talks a lot about the nutritional and movement aspects of it, but you really brought something interesting up with the social aspects. So that just gave me a little bit of insight to that. I also really appreciate the fact that even on your website, under the oxytocin section, you actually cite hug therapy as a way to increase oxytocin. So it kind of reflects the importance of social interactions to you. So I give you kudos to that.
Oh, thanks. It's something I think it's kind of overlooked, and the thing is that we're now starting to understand the physiology. So when you deal with people with any kind of cortisol issues or with any gut issues, which as you know is a pretty long list of conditions, oxytocin modulates both those systems. So there's some interesting science behind the social aspect of oxytocin.
Very cool. So we're at the point of the show now where we're going to get to know you a little bit and do a little bit of rapid fire questions about what you do for your health. So what's something that Michael Arata does for his own health that not enough people know about or understand?
Let's see. Well, I really like yoga. I think that for the amount of time that you have to do something, yoga is the best bang for your buck. You can work from a resistance training point of view, a stretching component on the physical side to the mental aspect, and then also breathing. So I really do think that yoga is something that all of us should actually participate in, and yoga is also something that people with disabilities of various sorts can do. So I think it's a good core thing to do for your wellness. So I don't know if I'd say people don't know about it. Pretty common, but I think it's something that I find is very foundational.
Yeah, I think it's definitely underappreciated as well. A lot of people only really look at it as a stretching benefit, or people think of it as a fitness program, but the mental and emotional benefits that people get from yoga are pretty astounding when people experience them too.
Absolutely.
What are some of the best books that you recommend for people?
Well, the one I'm reading now, which I'm finding very interesting, and I think it would apply to many situations, is You Are the Placebo. And it's basically exploring the power of the mind to heal the body. And it's a really fascinating book. So that would be one I think that anybody that's got any kind of chronic condition would be interested in looking at.
Nice. I'll definitely post that in the show notes for anyone that's interested in looking that up. Do you subscribe to a particular type of diet?
I think that if I had to pigeonhole it, I'd have a tough time because I've kind of taken things from various styles of eating. I consider diet a four-letter word. I like styles of eating.
Sure.
The key for me is that it's got to be anti-inflammatory, avoid inflammatory foods. And I do get a lot of plants in my diet, so I'm probably eating 10 to 12 servings of plant-based material. I do eat meat, but it's not as much as I used to, and I try to make sure it's grass-fed, organic. I eat a lot of lamb, actually.
Nice. Do you recommend supplements for people? What are your thoughts on that?
I do have a few supplements that I do recommend very consistently because it's just not possible to get them in sufficient quantity in the diet, and that's vitamin D. You like myself live in a sunny area, and people kind of think that, gee, you spend 15 to 30 minutes outside in the sun and you've got all the vitamin D you need. Actually, that's not the case. So even for people that are in the sun a lot, I do recommend vitamin D as a supplement. The other thing which I think is pretty chronically deficient in the U.S. population is magnesium, and that should be supplemented, in my opinion. And then iodine is another one which I think you can get it through your diet, but the problem is that not a lot of people like seaweed, and I think that's the best way to get it. So if you have someone that does enjoy seaweed, then I think you can get sufficient iodine. But absent that, that might be one you might want to consider supplementing because that's a serious problem.
So iodine, unless you spend most of your time eating in a sushi restaurant and getting it as an appetizer then.
Yeah, exactly.
Okay, so you probably touched on this a little bit before, but what is one thing that someone can do today that would instantly make their lives better health-wise?
Well, I'd say the thing that you could do right now to make your health better is breathe.
Breathe.
Yeah, breathing is just something in Western culture we don't do well.
Sure. Do you subscribe to like a specific type of breathing pattern? Because I know that there's different schools of thought on it.
Yeah. There's a number of different approaches to breathing, and I find for most patients I see, they tend to be in sympathetic overdrive for most patients. And so I want to try and balance that out with parasympathetic tone, and a prolonged exhale relative to the inhale is going to do that. So I think Dr. Weil is the one that's kind of brought the 4-2-7 breathing to the forefront. And that's basically just a prolonged exhale. So that's my approach for most people, is just to get them to have a minute or two where their exhalation is longer than the inhalation, and it's really the goal is to increase parasympathetic tone.
Okay. And what is, in your opinion, probably the most detrimental thing that's affecting way too many people as far as their health goes these days?
Well, that's hard to answer in one word. Gosh. Yeah, I guess I would say not getting proper sleep. I think that is probably the thing that's most neglected by people.
Okay, awesome. Let's see. And the last thing, what's the thing that you think that people who are chronically ill, what's like the thing that leads them down this path, and do you think is the thing that they're missing?
As far as what gets people, down a path of chronic illness, I think that it's not their fault. I think it's our society. I think that we have created an environment, both the environment in the outdoors and in terms of the environment inside our bodies, where we are creating inflammation. And if if you can make the appropriate choices to calm that inflammation, you can prevent disease or you can overcome it. But unfortunately, that's not the case. I mean, we've damaged our environment, and so it's not someone's fault really is the issue. And so maybe the thing to do is get people to understand that it's not their fault, but they do have a choice once they've realized the situation to change it. So I guess toxin maybe would be the best way to describe it. We've poisoned the environment.
Got it. And I think a lot of people that are listening, especially people in that chronic illness class, will really appreciate those words. Well, hey, I've had a really good time interviewing you. I think gave the audience a lot of stuff to chew on. You are pretty active on social media, and you're pretty easy to find on the web. But why don't you give people an idea of how to get a hold of you, how to find out more about you, and to find out more about your readings or writings?
Sure, thank you. Yeah, so my website is autonomicspecialist.com. And as you mentioned, you can actually find me by typing my name into to any social media or Google. And the practice phone number is 949-247-8877.
Awesome. Well, it's been a pleasure, Michael. Thank you so much for coming to our show, and good luck in everything in sunny California, and we'll talk to you soon.
All right, great. Thank you so much. It's been a real pleasure.
Thanks for listening to Heal Yourself Radio. If you like what you hear, show us some love on iTunes by writing a review or by sharing with your friends. We love interacting with our listeners. You can follow us on Facebook at facebook.com/healyourselfradio. You can find me on Twitter at Dr. Jonathan Chung. And you can always come to our website at healyourselfradio.com and interacting with us in the comments section. Hope you enjoyed the show. We'll see you next week.